Welcome to the video, Unmasking Psychotherapy's Favorite Misconstruals, Letting Go of the Medical Model and Its Underlying Assumptions. My name is Dr. Stephen Bacon. I'm a clinical psychologist in Santa Barbara, California, and I've spent the past decade writing books and researching exactly how psychotherapy works. A place to begin. We have to begin by cultivating an awareness of the human psyche and its problems and potentials that differs from the standard awareness. Fortunately, there is a path that leads to that different awareness that arises out of the psychotherapy outcome literature. Western personal growth and Western psychotherapy are inextricably intertwined. They rest on the same core assumptions. They stimulate each other in that when a new idea arises in one area, it migrates to the other. To begin our journey to a new awareness, we begin with examining the assumptions about how psychotherapy works. How psychotherapy works. Psychotherapy works. It has an average effect size of 0.8, which in common sense language means that the average treated psychotherapy client is better off than 80% of the clients in a waiting list control group. Once there was proof that psychotherapy worked, the next pressing question was which approach was the most effective. Complicating this debate is the fact that there are various schools of psychotherapy. Some calculate over 300 different ones, and these schools have very different assumptions about the psyche, the nature of human problems, and the best approaches and techniques to resolve them. The equivalence of the different schools. These big differences between schools and their philosophies made psychotherapy look less like a science and more like a craft. It was hoped that research could help clarify the field and show which of these ideas were superior. Unfortunately, the research studies consistently reveal that all the approaches work and they work equivalently. This conclusion is called the Dodo bird theory, after the Alice in Wonderland reference that all have won and all must have prizes. This Dodo bird conclusion is supported by many large reviews that statistically combine different individual studies, so-called meta-analyses. While these meta-analyses have repeatedly validated the Dodo bird concept, these conclusions have been challenged because the implications of the Dodo bird threaten psychotherapy's basic assumptions. The provocative nature of the Dodo bird. The problem with the Dodo bird finding is that it's hard to believe that all these wildly different approaches, with disparate techniques and contradictory underlying philosophies, could possibly achieve equivalent outcomes. In psychotherapy, like in medicine, everyone loves techniques. Both clients and therapists attribute therapeutic success to their employment. Hypnosis really cured my bad habits. Cognitive behavioral therapy worked for my depression. Working through my PTSD experience with EMDR resolved my symptoms. Now, the research is telling us that all these wildly different techniques come up with the same results. And it's not just the old techniques. When we invent new techniques, they also generate the same equivalent results. No one beats the 0.8 effect size, and no one does worse than the 0.8 effect size. This equivalency can't just be due to coincidence. It's especially hard to believe in coincidence when all the new techniques get the same scores. Dodo bird suggests that something else is operating in psychotherapy beyond techniques, something that dwarfs or replaces the power of techniques. Common factors. Psychotherapists have long been aware that every approach had certain factors in common. These common factors have been defined differently, but the most frequently used definition is a relationship with a wise and caring individual. Since none of the specific and vastly different techniques could demonstrate superiority, the Dodo bird finding suggests that all the change must be due to these common factors. When you give up on the coincidence theory, all that's left is the idea that psychotherapy techniques are rituals that work via beliefs and expectancies. This conclusion, while logical, is an anathema to most psychotherapists. They wanted the techniques they had invented and perfected to get some credit for change. Besides, psychotherapy wouldn't be much of a science if it couldn't develop powerful and effective techniques. The common factors endorsement also destroys the medical model. If techniques are out the window, diagnoses fly out soon after. Different diagnoses require different interventions. If all we have are common factors, we're going to lose the power of diagnoses and the essence of the medical model. Discard the medical model, and you discard the idea of psychotherapy as a profession. Attack on the dodo bird. As a result of these arguments, the first priority of the medical model advocates was to attack the dodo bird finding. Fortunately, they had some pretty good arguments. They cited all the studies that showed that some approaches were better than others. In addition, they referred to dismembering studies that showed that specific factors, techniques in the underlying systems, were responsible for 15% of the change effects. The common factors group fired back with the arguments that both the superiority studies and the dismembering studies were compromised by bad experimental design and allegiance effects, the tendency of a therapist in a study to be more effective with the treatment they believe in. Arguing to stalemate. This resulted in a stalemate that endorsed both common factors and the power of techniques. Most therapists believe that common factors are important, but they continue to believe in the inherent power of techniques. There is a vocal minority of therapists who reject specific factors entirely, but the main effect of their efforts is that common factors are considered more important. Moreover, the medical model continues to be the dominant idea that explains human problems and how to resolve them. What should be emphasized is that the common factors arguments were compelling, but it was an uphill struggle for them. Essentially, they were arguing against common sense. Most everyone feels that techniques have inherent power, that diagnostic categories are real, and that the field is evolving. Saying that my interventions are evidence-based sounds appealing and scientific. Embracing a perspective that rejects these assumptions simply feels wrong, regardless of how logical it might be. Resolving the stalemate. However, there is a way to resolve this stalemate, and the solution is both simple and based in irrefutable common sense. We can examine therapist training and experience effects. Trained therapists know techniques, and the untrained don't. If techniques have inherent power, trained therapists will get better outcomes than the untrained. Similarly, more experienced therapists know more techniques and have practiced them more assiduously than the inexperienced. If techniques have inherent power, experienced therapists should best the inexperienced. Testing training effects. There are only two studies that compare untrained with trained. Strupp and Hadley compared the results of licensed therapists against college professors. Both groups were equally effective. This study was replicated by Anderson et al., where he compared fourth-year clinical psychology graduate students against fourth-year graduate students in history and biology. Again, both groups achieved equivalent positive results. Researchers hit the training effects jackpot, however, when they compared licensed therapists against paraprofessionals. Paraprofessionals are untrained psychological technicians who work in programs and agencies and provide therapy to clients in those programs. In literally almost 200 studies, the paraprofessionals got slightly better results than the licensed therapists. The untrained match the trained. There have been only a few studies comparing master's level therapists with doctoral level therapists, and those studies failed to find any meaningful differences between the two groups. In summary, across hundreds of studies, there is no evidence of any correlation between training and better outcomes. These findings suggest that untrained therapists, like beginners or coaches with a weekend workshop worth of training, get the same results as licensed therapists with many years of training. Experience effects. It's very easy to measure experience effects because in our thousands of therapy outcome studies, we often ask how many years the therapist has been practicing. Contrary to what the therapist might expect, meta-analyses that lump all these studies together fail to find any relationship between experience and outcomes. Moreover, Scott Miller and his colleagues believe that they have found some evidence that outcomes decline modestly with more experience, kind of like a slowly deflating balloon. In sum, Given the absence of training and experience effects, it is clear that the Dodo bird debate is resolved. There are only common factors in psychotherapy. What appears to be specific factors, techniques, is simply the operation of placebo, beliefs, and expectancies. Privileged knowledge. But there's more, as the late night commercials promise. If there are no training and experience effects, then psychotherapy's privileged knowledge is also unrelated outcomes. Privileged knowledge is the knowledge amassed by a profession that is essential for functioning as a professional. In psychotherapy, it includes techniques, but it also encompasses diagnoses, underlying systems, treatment philosophies, and client characteristics. It's everything that is taught in graduate school, everything one needs to practice as an independent professional. This has huge implications. For one thing, since beginners equal experts and therapists don't improve over time, it means that when graduate students arrive at their training program, they can already equal the results attained by the professors. Confusions and misleading assumptions. But that's just the beginning. These results reveal that most psychotherapy assumptions and claims are unfounded and misleading. For example, when a therapist claims to be better because they have specialized in eating disorders or adolescence, they are revealing their confusion, not their experience. If a program states that they use evidence-based interventions, they miss the point that there are no non-evidence-based interventions. Everything works and works equivalently. When a therapist learns a new technique or approach and claims that this has improved their competence, they are confused. If they claim that your improvement is due to skills they have taught you, they are confused. If they read a book about parenting skills, they can claim that the book has helped some people, but not more than the 30 books that already exist on parenting skills. And if a therapist tells you the field is evolving and getting better outcomes than 30 years ago, they simply haven't reviewed the outcome literature. No evolution is possible when we are simply reinventing the wheel. We're not in Kansas anymore. If all of psychotherapy's privileged knowledge is unrelated to outcomes, it is clear that there has been some truly startling misunderstandings about basic psychological assumptions. Literally, we have a century of work by some of humanity's best and brightest, and the research concludes that all their efforts have amounted to naught. This is reminiscent of the kind of wrong road that many physicians walk down before germ theory, as they chase the ideas that disease would due to miasma, or an imbalance in the four humors, or sinful behaviors. With a wrong foundational assumption, even the brightest individuals can expend a great deal of effort and end up generating nonsense. The confusing nature of positive placebo. It should be recalled that doctors that believed in different pre-germ theories, like miasmas or the four humors, did have a significant level of success in terms of curing their patients. This was partly true because the human body is self-healing, and partly due to the fact that they had some therapeutic treatments, even when their foundational assumptions were wrong. But it was primarily due to the power of positive placebo. When a credible healer assures a patient that this intervention is going to help them, this assurance creates a powerful placebo response, leading towards cure and health. The sum total of these responses led to lots of cures and inadvertently supported the idea that the misleading foundational assumptions were correct. Curing mostly with the power of placebo resulted in the medical field failing to evolve. They couldn't really start improving till they rejected the false foundational beliefs and replaced them with germ theory. The challenge. This is what lies before us at the present time. The research revelations have demonstrated that we have been barking up the wrong tree. Yes, psychotherapy works, but our understanding of how it works has been crippled by our commitment to believing inadequate foundational assumptions. Given the personal growth and psychotherapy are highly intertwined, the personal growth world is as limited as the psychotherapy world. Yes, personal growth works in its present form, but it is poised to work much more effectively if wrong thinking can be replaced with right thinking. The next step involves understanding why our current assumptions have failed and what can replace them.